Now coming to free gingival graft. Okay, so till now we have seen about the pedicle graft. Now moving on to the free soft tissue graft. Okay, so I'm going to completely detach the tissue from the donor side and I'm going to place it in the recipient side, right? So free gingival graft, as I told you earlier, it has epithelium plus some portion of connective tissue. Okay, and since it is a free soft tissue graft, it can be taken from the palate, or it has to be taken from one side, which we predominantly take is the palate. So we are going to take the tissue from the palate and you are going to graft it in the side. So there are two surgical sites, right? So there are two surgical site, and the most commonly preferred site is palate. Okay, the most commonly preferred site is palate. And one of the drawbacks of a free gingival graft is, a few drawbacks of a free gingival graft is, there is improper color matching, poor blood supply to surgical sites, so there will be increased bleeding at the palate area, the donor site. Okay, the tooth which has recession becomes a recipient site, and the palate which gives the tissue becomes a donor site, so it has a increased bleeding, so difficult to stop the bleeding. Okay, difficult to achieve hemostasis. Fine, now moving on to the technique, we shall see how it is done. Very simple. So here I see recession. Okay, here I'm able to see probably some 2 mm of recession. So what I'm going to do is, I'm going to do a thorough scaling and root planing, thorough scaling and root planing, which is followed by application of root biomodification agents like citric acid or tetracycline hydrochloride. This procedure, SRP and root biomodification agents, is applied for all the procedures till we have seen, taking from the pedicle graft, rotational your advanced flaps, to the free gingival graft and connective tissue graft. All the procedures require this step, because to make sure we are removing the smear layer and the root surface is clean smooth. So SRP is done, root biomodifications are given. Now what I'm going to do, I'm going to de-epithelize this area. As I told you earlier, I'm going to de-epithelize this area so that the donor site is ready with the connective, sorry, the donor site is placed over the connective tissue of the recipient site, as you can see here, right? So I'm giving, I'm using in this case they are using blade. You can also use Orban's knife to just scrape off the epithelium, right? So it looks something like this. So the epithelium, as you can see here, is completely scraped off, and this is going to be my site of placement of a graft. So I'm going to measure the site with the help of a tin foil, right? So once this is done, I'm measuring the area with the help of a tin foil, and I'm going to place this in the palate. So what is this area where I can take this graft? I cannot randomly go and place the tin foil in the palate and take the tissue. There are some specific areas where I have to take. So I can take it from distal of the canine to the mesial of the second molar. So within this area and 2 mm away from the gingival margin. Okay, so 2 to 3 mm away from the gingival margin, distal of canine to mesial of the second molar, I can take a graft. Okay, so see here, I have placed a tin foil, I have just marked the area, and I'm going to take the epithelium, plus some portion of connective tissue from the palate, right? So I'm going to place it at the donor, the recipient side, and I'm going to start suture. Suturing is very very important for a free graft, because the entire tissue has to be sutured and kept in place for the proper results. So the first suture what you are going to place is the horizontal stabilizing suture. Okay, so the first suture is horizontal stabilizing suture. So this is the horizontal stabilizing suture. So what I'll do, I'll take a bite in the graft, and I will take a bite in the gingiva and I will suture it off. Similarly, I will take a bite here and I will take a bite here. I will suture it off. So I will horizontally stabilize the graft, so the graft will stretch, as you can take a look at here. So two horizontal stabilizing sutures are placed, right? So the next one, what I'll do is I'll take a bite, I'll insert the suture needle here, I will take the suture needle out here, and then what I'll do is I'll rotate the tooth, I'll tie the knot here. You see here, take the bite, take the needle out here, rotate the tooth and place it here. Okay, like anchor suture or a sling suture. Okay, so I'm taking a bite in the periosteum and I'm encircling the tooth. I'm just pressing the graft towards the area and I'm suturing it off to avoid the dead space. Okay, so this is the second suture. The third suture, again this sling I'll put it in this area. This sling I'll put it again in this area, so it will look something like this. Okay, it will look something like this. So two slings, right? So both are encircling the tooth, and this is the basic. If at all at this stage I see still the graft is bit mobile, I will add whatever suture I want. I can put another horizontal stabilizing suture, or I will put another sling suture. So basically I'll put horizontal stabilizing suture both ends, then a closed anchor or a sling suture encircling the tooth taken from the periosteum. Two sling sutures, two horizontal stabilizing sutures. If it is not stabilized, I will take another sling or another stabilizing suture. Whatever it may be, I'll just make sure there is no dead space. So this completes the free gingival graft, right? It's very simple, right? So free gingival graft is usually harvested from the palate. So secondary surgical site, you can keep gel sponge, or you can try to suture the area to avoid bleeding. Fine. Now moving to the connective tissue graft. So connective tissue graft, if you see, it has excellent color matching, and also the connective tissue graft, since I'm taking only the connective tissue, the epithelium overlaying the connective tissue is safe, so I can suture it quite comfortably compared to the free gingival graft, and also there will be reduced bleeding. Okay, as in free gingival graft the palate will be exposed as such, but in connective tissue graft what I'm going to do, I'm going to take only the connective tissue. The overlying epithelium I'll just flip over it and suture it off, so the hemostasis will be good compared to free gingival graft, and main thing is there will be good color matching. Okay, and always remember, a connective tissue graft cannot be placed outside, as you see in free gingival graft. Free gingival graft can be placed outside, but connective tissue graft can be only tucked in. Okay, connective tissue graft can only be tucked in, so I should raise a coronally advanced flap or a tunnel, whatever it may be. In this case, what they have done is they have raised a coronally advanced flap. Okay, again coronally advanced flap plus connective tissue graft becomes a gold standard, right? So I'm measuring the recession, two vertical releasing incisions, raising a full thickness mucoperiosteal flap, right? So raising a full thickness mucoperiosteal flap, as you can see here, and then what I'm going to do, I'm going to do a nice scaling and root planing, which is followed by curettage and root biomodification agents, and then I'm going to take harvest from the palate. Okay, so I'm giving a small horizontal incisions 2 to 3 mm away from the gingival margin, and then I'm going to split the epithelium, and I'm going to give incisions. See this part, can you see here? This is the free gingival graft. This is the free gingival graft. Okay, so the free gingival graft is reflected from the connective tissue, as you can see here, and this portion of connective tissue is taken, okay, and it is tucked into the area where the coronally advanced flap is raised. As you can see here, this is the connective tissue, it is tucked into the coronally advanced flap which has been raised, and it is sutured, right? So the connective tissue graft is usually harvested again from the palate. So what I'm going to do, a connective tissue graft cannot be placed as such, it has to be tucked in. So I am, in this case I'm raising a coronally advanced flap. How to do a coronally advanced flap? Two vertical releasing incisions, is followed by a full thickness mucoperiosteal flap, and then I'm doing scaling and root planing, apply root biomodification agents, and I'm measuring with the thin foil. I'm measuring the area to be treated. I'm placing the tin foil in the palate, and then I'm going to reflect the first. I'm going to dissect the epithelium. I'll just move it off, and then the underlying connective tissue, I'll just place another very similar incision to FGG, and I'll take this connective tissue graft and overlying epithelium, I'll just place it over and suture it off. Right, so this is what connective tissue graft looks like. Again, it is technically demanding, and also you might need to trim the tissues if needed. Okay, so with this we come to a conclusion of various root coverage procedures, and also I'll be talking about a few other perioplastic procedures, and we'll be seeing soon. Thank you.